1. Tell us about yourself and your nursing background. Why they ask. Interviewers start with this to assess communication skills, confidence, and fit. Keep it structured, not a life story. Indeed.
Model answer. I am a registered nurse with 5 years' experience in acute care, including 3 years specializing in cardiac and cath lab settings. I've assisted with angiograms, angioplasties, and stent placements. Alongside clinical work, I hold ACLS and BLS certifications and enjoy working in fast-paced teams. Explanation. Brief overview of experience. Mention relevant certifications. Keep focused on cath lab relevance.
2. Why do you want to work in a cath lab and specifically in Australia/NZ? Why they ask. Assesses motivation and whether you've researched the role and healthcare environment. IntelliCare.
Model answer. I'm passionate about high-acuity cardiovascular care. Working in Australia/New Zealand aligns with my professional growth goals and their strong focus on evidence-based practice and patient safety. Explanation. Asterisk shows intentional career path. Asterisk connects to local healthcare values.
3. What experience do you have with cardiac catheterization procedures? Why they ask. Cath lab nursing is technical, they want evidence of real procedure exposure. Interview prep.
Model answer. I've assisted in hundreds of procedures, including diagnostic angiograms, balloon angioplasty, and stenting. I prepare patients, monitor vitals during interventions, and conduct post-procedure care. Explanation. Highlight both pre-intra, and post-procedure experience. Mention procedures by name.
4. How do you ensure patient safety before, during, and after a cath lab procedure? Why they ask. Patient safety is non-negotiable in high-risk environments. Interview prep.
Model answer. Before procedures, I verify identity, allergies, labs, and consent. During the procedure I monitor hemodynamics, ensure aseptic technique, and communicate with the team. After, I assess for bleeding, pulses, and educate patients about recovery. Explanation. Covers the entire procedure cycle, essential for caregivers.
5. Explain sterile technique in the cath lab. Why they ask. This tests infection control knowledge, core for procedural units. Interview prep.
Model answer. Sterile technique means maintaining a sterile field, correct donning of PPE, and preventing contamination of equipment or site. This reduces infection risk and protects both patient and staff. Explanation. Shows understanding beyond memorized words.
6. Describe a time you handled a high-pressure or emergency situation. Why they ask. Cath lab work is stressful, they want to know you can stay calm and effective. IntelliCare.
Model answer. During a sudden hypotension episode in a PCI, I quickly notified the cardiologist, secured 4 access, checked equipment, and supported the patient while maintaining clear communication with the team. The patient stabilized successfully. Explanation. STAR technique works well here: situation, task, action, result.
7. How do you communicate with patients who are anxious or afraid before a procedure? Why they ask. Shows bedside manner and emotional intelligence. Indeed.
Model answer. I explain the steps clearly in simple language, answer questions, and use calming techniques like guided breathing. If needed, I involve family and translators to ensure comfort and understanding. Explanation. Good communication improves patient cooperation and outcomes.
8. How do you manage multiple tasks when the lab has multiple procedures scheduled? Why they ask. Tests prioritization and organization skills. Interview prep.
Model answer. I prioritize based on clinical urgency, patient stability, and procedure complexity. I make checklists, delegate appropriately, and coordinate with colleagues to ensure everything runs smoothly. Explanation. Shows strategic thinking, not just multitasking.
9. How do you stay updated with the latest cardiac care and cath lab best practices? Why they ask. Clinical practice evolves, employers want lifelong learners. IntelliCare.
Model answer. I subscribe to cardiology journals, attend workshops/conferences, and participate in in-service training. I also review local clinical guidelines regularly. Explanation. Demonstrates proactive professional development.
10. How do you handle conflicts with colleagues? Why they ask. Teamwork is vital in interventional units. Eva'S.com.
Model answer. I discuss concerns respectfully, focus on facts, and collaborate for solutions. If needed, I involve senior staff to maintain a positive working environment. Explanation. Emphasizes professionalism and conflict resolution.
11. What lifestyle changes do you advise patients at risk for heart disease? Why they ask. Shows patient education skills, important post-procedure. Fixed career.
Model answer. I counsel on diet, exercise, smoking cessation, blood pressure and diabetes control, and regular follow-ups, tailoring advice to each patient's readiness and context. Explanation. Highlights holistic care beyond the procedure.
12. Why should we hire you for this cath lab role? Why they ask. Assesses confidence, fit, and unique strengths. Indeed.
Model answer. My cath lab experience, commitment to safety, strong communication skills, and eagerness to contribute to your team make me a strong candidate. I thrive under pressure and prioritize patient outcomes. Explanation. Summarizes fit and value succinctly. Optional end of interview question, for candidates to ask. What support and ongoing training do you provide for clinical staff? Why ask this? Shows engagement and desire to grow.
13. Are you willing to take on-call duties? Why they ask. Cath labs commonly run emergency PCI and after-hours cases. Nurses must be dependable and understand what on-call means.
Strong model answer. Yes, I am willing to take on-call duties. I understand the cath lab performs emergency procedures outside normal hours, and timely response can be life-saving. I am familiar with expectations such as being reachable by phone, responding within the required time frame, and being prepared to work under pressure. I manage my schedule and rest appropriately when on call so I can provide safe patient care. Why this works. Shows readiness. Acknowledges responsibility and safety. Demonstrates realistic understanding of on-call demands. Important caution. Never say, anytime, 24/7, every day, looks unrealistic and unsafe. Say you can manage on-call roster with proper planning.
14. Why did you choose this hospital/health service? Why should we select you? Why they ask. They want to know you researched the employer, not applying blindly. Also tests motivation and cultural fit.
Strong model answer. I am attracted to this hospital because of its reputation for high-quality cardiovascular services and evidence-based practice. I value the structured clinical support provided to new staff, ongoing professional development, and multidisciplinary teamwork culture. I believe working here will help me advance my skills safely while contributing to excellent patient outcomes. Why this works. Connects personal goals with hospital strengths. Signals long-term interest. Avoids generic complimenting. Add the follow-up if they ask. Why should we choose you for this role? Strong model answer. You should choose me because I combine clinical experience with a strong commitment to safety and teamwork. I remain calm during emergencies, communicate clearly with doctors and colleagues, and provide compassionate patient education. I am motivated to continue learning, and I am ready to contribute positively to your cath lab service from day one.